Cow milk protein allergy is of three types. It can be IgE mediated, it can be non-IgE mediated, or it can be mixed type. A child with IgE mediated allergy presents immediately as milk is introduced to the child. Child may have rash on the face, immediate vomitings, swelling of the lips, where the body reacts to milk protein. While in non-IgE mediated, child may remain well for first initial 15-20 days, and after that child starts with reflux and irritability and fussiness. At times child may have diarrhea or blood in stools, or sometimes even constipation or uncomfortableness and irritability and arching because of cow milk protein allergy. It is very different to lactose intolerance, which is loosely used. Lactose intolerance is because of enzyme deficiency of lactase, which is very, very rare primary in babies. So we must rule out cow milk protein allergy. It can be overdiagnosed also, because just because a child is irritable for little time in a day, somebody might say he has CMPA. It can remain underdiagnosed also and can lead to long-term weight loss in the child and affect his height and growth. So I think it's very important to consult a pediatric gastroenterologist if your child is showing any of these symptoms, and to properly diagnose CMPA. Now you will ask me, how do I diagnose CMPA? The tests of IgE or specific IgE blood levels or skin prick test, these are not really useful. They are only useful when a child is having IgE mediated type of allergy, which is quite rare. The more common one is the non-IgE mediated, where it's the detailed clinical history that we get from the parent and sometimes from the grandparents about the child's behavior and his weight and his blood in stools, and then we diagnose. And it is basically, we do an elimination diet for 2 weeks of milk and milk products. If the child is breastfed, the mother is not allowed to take milk and milk products. It includes complete exclusion, like the mother is not allowed to take ghee, butter, biscuits, milk, curd, charge, anything. She excludes everything in her diet, and then we see how the child is responding. So if we see that after 2 to 4 weeks the child is doing well, we give a challenge again and see if the symptoms reoccur. So it's the elimination diet followed by a challenge which helps us diagnose cow milk protein allergy. But it's very uncommon in breastfed children. It has been seen to be more common in formula fed. So in such formula fed children, we give them a trial of extensively hydrolyzed formula for 2 to 4 weeks, and then we see the response and re-challenge. So you should not overdiagnose CMPA also. However, it should not be underdiagnosed as well. So consulting the right pediatric gastroenterologist and getting your child diagnosed is very important.